welcome. My name is Jodi Hubler, and I am looking forward to spending the next hour with you facilitating what is going to be a fascinating and wonderful conversation with my esteemed guests. We're taking a deeper look at the lasting impact of virtual care. 2020 clearly was a moment for virtual care meeting its market opportunity, and I'm excited to unpack the topic with you over the next hour. Few administrative details. First, thank you to Medical Alley Association and to Bind Benefits for hosting this conversation today. And as a reminder for you participants, the Q&A function is available. We have colleagues who are monitoring the chat, and we'll have an opportunity to bring some of those questions forward during our hour. Those questions that aren't addressed will have follow-up following our time together. So without further ado, let's dig in. As I mentioned, telehealth, virtual care, the recontouring of the value chain was clearly an imperative in 2020. Titles like telehealth and virtual care is not just a fad. Statistics like anywhere from 154% increase to 225% increase in telehealth and virtual visits during the pandemic. We saw the unbundling of hospital, the rise of digital-first provider networks, and the very definition of clinical practice being redefined across traditional geographic and boundary lines. I'm excited to welcome and host a conversation among these esteemed colleagues. Dr. Batra, would you please begin the introductions, and we'll go from there and jump in the conversation.
Jodi, good morning, everyone. My name is Romilla Batra. I am a primary care physician by background and also the Chief Medical Officer of Scan Health Plan. Wanted to give you a little background on who we are. Scan Health Plan was founded about 40-some years back, believe it or not, by 12 angry seniors. It's not a myth, it's a real story, who wanted more to care than just medical care, doctors and hospital, and wanted to have a social wraparound. So our roots are in social HMO. We were the longest serving social HMO from CMS demo model. And since then, we have evolved into a MAPD model. We're based out of California. We serve about 225,000 members. All of them are Medicare Advantage members. We also pride ourselves in serving the most frailest and the vulnerable populations. So we have all the special needs plans, if you're familiar with them. They are chronic special needs plans. We serve the end-stage renal disease plan and the dual special needs plans as well. Very excited and very proud. We've been a 4.5-star plan for the last 3+ years. And I've continued to work towards keeping our mission of keeping seniors healthy and independent. And it became very apparent during the pandemic, as many of my colleagues would share with you folks, it was not only getting access to people to medical care, but it was also getting access to people around social care. So I would love to share with you in the ensuing dialogue that we are going to have about how we were able to provide that access, whether it be through video platforms or it be through the audio platforms. Thank you for including me in this panel.
Absolutely, thank you.
Hi, everyone. My name is Nikole Benders-Hadi. I'm the Medical Director of Behavioral Health for Doctor on Demand. I am a psychiatrist by training. I also have a background in public health, given my bachelor's in public health, and I also completed a fellowship in public psychiatry. So I've definitely always had a passion for population and community health issues, as well as exploring opportunities to increase access to healthcare. Doctor on Demand is a virtual healthcare platform providing 24/7 access to urgent care, primary care, as well as behavioral health services provided by psychiatrists, psychologists, and master's level therapists, all through video-based visits. Our mission is to improve the world's health through compassionate care and innovation. And we do that by our commitment to putting the patient first, developing long-term patient-doctor relationships, and providing families with peace of mind through fully integrated mind and body care. We are based in San Francisco and have the privilege of serving over 98 million covered lives. So I'm really happy to be here to talk to you about such an important topic today as the impact of virtual care.
Thank you.
And thanks, everyone. Thanks, Jodi and Medical Alley Association for the opportunity to speak today and this amazing panel. I'm Dr. Tara Bishop. I serve as Bind Benefits Chief Clinical Officer. I have been with the company for almost 3 years and have the privilege of leading our clinical operations function at the company. Bind, for anyone who doesn't know, is a relatively new health plan that is really creating a new model of health insurance, a personalized model of health insurance. And our goal with a personalized health plan that Bind is to really ensure that members and patients have clarity in terms of the cost of their care, the options for their care, and really understand the prices for the kind of care that they are getting. And we do that again through a new health insurance model that has really leveraged virtual care and telehealth, and we're really looking for opportunities to provide coverage for this kind of care. My background is in clinical medicine. I'm a general internist and have had both an academic career and an opportunity to serve in industry, both as a consultant and in the health plan space, and looking forward to the discussion today.
Wonderful. Thank you to all of you for joining us today, and look forward to unpacking this topic and the many nuances that we plan to cover as well. Dr. Bishop, let's start with you. You mentioned not only your academic background, your clinical practice, and even your consultant background, and now your most recent experience with Bind. It's clear that virtual care is transforming that healthcare journey. Can you set the stage for us? How is virtual care transforming the health journey for across the industry?
Yeah, that's a great question, Jodi. And, I actually want to take us back a little bit to, I was actually thinking about this discussion and sort of where healthcare was when I first started practicing. So in the early 2000s, if you had said to me, there will be a day where people will start to get care by doing video visits with their doctors and not going into practices, I would have never thought that I would have thought you were joking. This is a time I think back to my residency where we were using paper charts. We barely had electronic orders, and I think many of the problems that I saw in healthcare was this revolving door of people coming into the healthcare system, leaving the healthcare system. Access to care was a tremendous issue. This is before the Affordable Care Act was passed, and so these issues in healthcare existed 20 years ago. Many issues continue to exist, but what's fascinating is to see this evolution of technology. And not just technology, but also, I would say, a cultural change in how we are accepting of new models of delivering care. We all know that there's been a big change in how virtual care is being delivered, and the acceptance of virtual care largely from COVID. And this past year, we've seen such tremendous growth in the use of virtual care because of the need to actually shift care from in-person care that turned out to be unsafe at times and unavailable at times to virtual care. And so this public health pandemic has really shifted the way we are delivering care. As I said, it's sort of fascinating to see how that shift has been sort of seismic in the last year. But when I think about kind of layering on my days of practicing medicine and brick and mortar medicine, I think three things really stand out in terms of how virtual care has really transformed the patient journey. The first is really an explosion in access to care that's very different than what would have been available to patients before. I think about my days of kind of running back and forth from exam room to see patients, the 15-minute visit. I think any general internist has practiced at some point in their career like that, and how hard it was for patients. I had a very busy practice for patients to come in and see me in the office when they had an urgent issue. And the issue of the availability of more access to care has been, a really eye-opening phenomenon, I think, in the healthcare system, and the ability for changing those journeys so that people don't actually have to come in to get care in the brick and mortar system, but can actually get a lot of care delivered from the comfort of their homes. I would say the other thing is what I'm starting to see is also transformation in the way we actually manage chronic conditions. And this is probably not the first version of how virtual care was first delivered, but the idea of actually now managing things like diabetes and high blood pressure that we used to manage actually in many ways, in ways that could have been managed virtually, but we never really had the systems or the infrastructure or even the cultural buy-in to be able to do those kinds of things. And so this opportunity to actually transform the way we deliver chronic care is again changing the patient journey. I think there's opportunity to be more engaged with patients in this sense, and to really change that chronic care trajectory. And I would just say the last thing that I'm also seeing is a real change in our ability to offer new and different kind of care. There are some really novel and innovative methods of perhaps delivering more care that's more lifestyle based, or care that's more education based and coaching based. That again, as a practicing primary care physician, we never had the time or the resources to be able to offer those kinds of specialized different kind of care. And so I think that also this ability to really lean into different kinds of care models are really changing the way patients are experiencing their healthcare.
Thank you, Dr. Bishop. You bring up a number of areas, and particularly your commentary around how COVID and the pandemic actually accelerated many of those, right? Almost a market that's been 10 years in the making, meeting a definitive moment. And Dr. Benders-Hadi, you, through Doctors on Demand, have had a front row seat to almost an element of a before and after. And so I'm curious, layering on to that, how did the COVID public health emergency impact the use of virtual care? How did you experience that? And what have you seen in the industry?
Sure. Yeah, I think there absolutely has been a huge impact. I think, layering to what Dr. Bishop was just saying, it's really the realization that healthcare, it can no longer be this episodic, impersonal kind of experience, right? People need real human connections that can take into account the entirety of that person, and realizing that it's not one size fits all, right? So I think with the pandemic, what we've seen is a highlighting of a problem that was already present around healthcare access, but also a worsening of the world's underlying physical healthcare, physical health and mental health conditions and challenges, right? People are really very stressed, very scared right now, and quite naturally so. With Doctor on Demand, there's been a huge uptick in all visit types that we've seen, and growth in our behavioral health visits in particular. We've seen that roughly half of all of our Doctor on Demand visits are for patients who are diagnosed with at least one mental health condition. We've seen that the number of our therapy visits has tripled year over year, given the pandemic. I think it's also important to realize, when you're on the front lines, when you're seeing these patients, when you're making these diagnoses, even when you're exploring things like insurance claims data, that is always going to be an underestimate of the actual problem, right? What about all the individuals who have not made it into care, who can't afford to see a doctor for evaluation of whatever they're struggling with at the time? So I preface that in the context of what we're seeing with Doctor on Demand. One other point that we've seen, is looking at age groups and how that there's been differences in growth amongst medical needs for those populations. Definitely all of our age groups have been seeing an increase in visits and uptick in demand, but our highest increases have been in our 18 to 24-year-old age group, which is nearly a 200% year over year growth in visits. And then the second highest is our 65 plus age group, which is nearly 150%, right? So I think that there's a lot of learnings that we need to take from that. how we're better reaching these patient populations. We're seeing patients talk to us about the social isolation, the loss of income, the healthcare concerns, the anxiety about actually acquiring COVID-19, concerns about loved ones who are sick and dying. It's really, creating a tremendous strain on all of us. So the result of that is increases in depression and substance use and PTSD symptoms. And trying to track that over time, look at the impact over time, not only now in this acute phase, but long-term is a big part of what we're doing now as well. I do think, if anything good has come from the pandemic, it's number one, people acknowledging that you can access healthcare virtually, right? And that's going to go a long ways towards combating stigma and friction in the healthcare system. And then the other thing is that there was a study that showed that at this point now, 3 out of 4 Americans now believe their mental health care is as important as their physical health care. And so that goes back to, all that we also know on prevention and early detection of both physical and mental health issues to help reduce the morbidity of those things and as well as reduce the costs.
Thank you. Dr. Batra, I want to bring you into this conversation as well as we layer on from each of the panelists. I think one of the areas that has been underlying this is some of the historical context that Dr. Bishop talked about. And as Dr. Benders-Hadi talked through how the pandemic has brought advances, it's also actually exposed some of the more traditional barriers that really kept people from seeking virtual care as an opportunity. So I'm curious, from your perspective, what are some of the traditional barriers that keep people from seeking that in-person care that virtual actually can help address? How can we shift that?
I think there are a couple of things that we knew of and we saw more so during the pandemic. One was a group of folks who were ready to adopt, however, had not adopted because truly, the physicians hadn't taught through it, hadn't encouraged it, hadn't shared with them. There were no tele-video visits like we have today or had, 6 months back or 9 months back. That was a big deal. And let's also give props to the CARES Act that came out that kind of lifted off all these barriers. I mean, it didn't matter. You could use Skype, you could use FaceTime. And so suddenly people felt like they could have a video visit just like they were talking to their grandchild or their son across the state line or their daughter. So that encouraged them to adopt it. So that was the first barrier. Dr. Benders is absolutely correct. What we saw was the same thing. The adoption was really phenomenal in the first 2 or 3 months. I mean, our office encounters went down 70, 80%, but our tele-video encounters went up like 100, 120%. Huge, big deal. But then, one size doesn't fit all in medicine. All my co-panelists have said that, and that holds true for us also. As we looked at our population, we serve a diverse range of population, right? We have Hispanic population, we have people who speak different languages, people from different racial and ethnic backgrounds, and people who live in lower socioeconomic zip codes, people who have higher social vulnerability. That's where we noticed those people did not have access to even simple things as Wi-Fi. I mean, if we had to make SDOH a focus of the pandemic, I say give Wi-Fi to everybody as a Medicare benefit. People did not have access to Wi-Fi where they could have these kind of video visits. People who even had the iPads did not have the knowledge and wherewithal to say, well, how do I engage with my physician? I don't know how to get it started. I'll share with you an example to drive home the point. We sent one of our medical assistants to somebody's house and he or she had a video iPad but did not know how to use it. We set up a technical assistance line over the pandemic. And so we got a call from a 92-year-old who wanted to go on the Epic website and set up a video visit with his doctor. And it took us solid 2 hours to set it up. The reason being you have to have an email account. So we had to set up the email account. So those are the kind of barriers we ran into. So there were discrepancies based on your, where you lived in terms of your social vulnerability index, but there was also discrepancy based on how do I use this, and a sizable chunk of our population, I would say, is our average age is 74. So we lean towards an older adult more than a older adult, so as to say. So those were the two big barriers that we saw, where people did not know how to access care using the device that perhaps they had. And on the other end, we had folks that did not have a device or did not have a solid Wi-Fi. And for them, we came up, necessity is a mother of invention. That's what we saw. We had our physician offices set up drive-throughs to get the access, where they would get an iPad with the Wi-Fi that they could tap into. So it was interesting and amazing how quickly we learned through it. Another best practice that we learned, which I'm hoping it's going to continue on for a long period of time, we are working with the vendor that will take an iPad, like a GrandPad, drop it off at a person's home. There's just one simple link, you touch it and it connects you to your physician's office or doctor on demand or MD Live or whatever it is. Person will pick it up, clean it, sanitize it, take to the next person, the next person, the next person. So all those things, I mean, it's not that they suddenly became available today. We've had them for years. But there was a cultural shift, the mind shift that needed to happen. The regulation had to go away. The reimbursement had to come in. And so all those factors lined up as a somewhat of a silver lining from the pandemic.
I love it. I not only your necessity is the mother of invention. People will talk about the definition of luck as preparation meeting opportunity, and I think that's very much how you're closing out that commentary. That a number of these factors all were either in existence or in market, but needed that force function to come together to make that happen. So, Dr. Bishop, building on that. While we're also hearing about ways that we were able to bring virtual care mechanisms, whether that's the availability of the iPad, the ability to come alongside people in that technology journey, we're also hearing impacts and statistics reported. One recent one I found in prepping was that, patients indicated a preference that 91% of patients who were asked said they would stick to an adherence of a drug program through the help of virtual visits. Another 93 would utilize telemedicine to better manage a chronic condition plan or a condition-specific plan. So we're seeing the effects and the push towards a more virtual care model. You addressed that in the work that you're leading at Bind. So I'm curious, how has the push towards an even more virtual care either affected or enhanced the patient experience from your perspective?
Yeah, it's a great question. And of course, I think that's the central aspect that we are all working toward is how do you enhance the patient experience, whether you are on the provider side, like Dr. Benders-Hadi, or on the payer side, like Dr. Batra and me. Taking off my doctor hat, I'd love to put on my mom hat. So I'm the mom of 3 boys. I'm a working mom. Prior to COVID, traveled all the time. And it's interesting because, years ago, I actually did a study in looking at virtual care and kind of where was it starting to explode? Where were we starting to see traction? And the group that actually really started to really take it on early on were working moms, moms who didn't want to take off an entire day to bring their child to the pediatrician to have a sick visit. And I think that just speaks to the aspect of convenience and how the idea of virtual care is really changing the patient experience because it's making care more convenient. You can stay in your home. You don't have to sit in a waiting room for hours. You don't have to take off time from work to necessarily get the care you need. And in many instances, people are now getting care during hours that are very different than what would be normal hours of a healthcare, a provider system. So this idea of making it more patient-centric in the sense that you can really do it from your home and it's really surrounded, based on your schedule and what's convenient for you. I think the other thing is, and Dr. Benders-Hadi alluded to this idea of giving access to populations that may have felt either uncomfortable or stigmatized getting care. And the idea, we see this a lot with mental health care. We know that it's hard, getting into the brick and mortar mental health care system is difficult. Access to care is difficult, but also there may be stigma and there may be challenges of how you feel walking into an office to get this kind of care. And so the idea of virtual care really changing the way the way people feel about the care they're getting and the comfort they have in seeking out that care is another way I think it's really changing the patient and member experience. And I would say the last area that I think is, and you alluded to this, Jodi, this idea that there's an ability to now have more ongoing care. I spoke about how, some of the challenges of practicing primary care. I could see patients who had diabetes or heart disease every few months, but I didn't have that ongoing ability to kind of monitor and track and be on top of everything that they do on an everyday basis. And I see this not just in sort of the virtual care models of today, but I think this is really where virtual care is moving, is how do we get into the day-to-day lives of our patients in a good way, to be able to help them manage their conditions and optimize their health. So I think that's going to be both a positive thing in terms of helping people who have chronic conditions, but also engaging people to really be owners of their health and owners of their care.
Yeah, thank you, Dr. Bishop. I think the nuance and the perspective around that patient journey is vitally important, but I've also read, Dr. Benders-Hadi, that your view also on the role that virtual care can have in underserved and underrepresented communities. And so I'd really love for you to bring out and draw out for us how virtual care can help provide more accessible and actually more equitable care. I'd love for you to address that.
Sure. Yeah, there's absolutely a lot of really great data there. We certainly know that there's a lot of many sectors of the population that have had very limited access, not only to specialty healthcare services, but even primary care services. So the ability to increase access with virtual care is critically important, right? Then, of course, there are the regulatory changes around medical licensure for providers, for physicians, as well as the type of patient encounters that are billable, cost factors, things like implementing $0 copays for visits from our payers that has all been aimed at widening the reach of providers. Despite all of those, benefits that I think we've seen with the pandemic, I think that we also can't forget that a huge part of our responsibility is ensuring that virtual care is not worsening health inequities in any way, right? So Dr. Batra talked about, things like Wi-Fi access, right? Access to computers or having a mobile device, knowing how to use it, internet connectivity types of requirements. I think that those are absolutely things that we have to continue to be talking about as a very important part of this conversation. And then there's things like, what the healthcare workforce actually looks like. Having a diverse and representative workforce is certainly really important to us. A doctor in demand, it's as high as 29% of our behavioral health providers identify as ethnic minorities. And I think that equitable care equals culturally competent care. Right? I think that that's something that we all, in different healthcare systems need to be striving towards through things like employing a diverse workforce, providing cultural competence trainings. It certainly is true that providers are just more, patients, are just more comfortable seeing healthcare providers who look like them and are able to demonstrate an understanding and a compassion for where they're coming from. I think, what Dr. Bishop was just saying too, right? Pulling our patients into their own healthcare is absolutely going to result in the kind of sustained improvements and successful outcomes that we need to be able to see and demonstrate long-term to keep those regulatory changes in place that are going to allow for this kind of service delivery.
Thank you. Thank you, Dr. Benders-Hadi. Dr. Batra, you, as we've said, are uniquely positioned in your role to deeply understand the senior market as it relates to virtual care. And it's one that prior to the pandemic was often thought of as a potential high value target for change. Not only that, for investment. And we saw a significant amount of money flow into that area. There's some estimates that by 2024, that senior home care market will be over a $225 billion market. But there's also this immediacy of that transition. And I would be curious, you gave some wonderful examples in your prior comments, but I'd be curious, how have our senior populations who at times have been either labeled or realistically been less technically inclined, how do you see them beginning to engage in the market to respond to this opportunity for virtual care in that particular segment of the market?
Yeah, I feel like our healthcare system is the only system which is more provider-centric than customer-centric, right? Most of the organizations outside of healthcare are not customer-centric, they are not customer-obsessed. Whereas for us, we are still so far behind. We still want people to come to our offices, and even if they're homebound, we will send them a gurney to their home. We'll schlep them over so they can go see their doctor and get their visit taken care of in that particular context. I think what became very apparent during the pandemic is even for the folks who had inequities, who were racially or ethnically disadvantaged due to certain reasons, we could reach out to them and engage them in the ways they wanted to do it. So for example, for some of those folks, we did not have remote monitoring. They did not have remote monitoring. We still needed to check their blood pressure or their sugar. Guess what? We could still send a medical assistant to their home with a device that could facilitate the conversation. And so that was something which they were willing to do. The second thing that was very interesting is even for some, even if the video visit was the right answer, they still felt comfortable with the telephone visit. And so the good old telephone came in really, really handy because they have been used to using it. And there are certain things that we felt you could still continue to manage on the telephone. So medically, if somebody's checking their blood pressure, you could kind of talk to them on the phone. So we encourage those folks to stay that way. I think the third thing that became very apparent is how we could really engage the caregivers, which is very hard to do in the traditional brick and mortar. So I'm a caregiver to my in-laws. If my in-laws have an appointment, I have to block my day, go get there, wait in the waiting area. And then I'm like, okay, then I outsource it to my husband. So it's not continuity of care in my life, right? But if we looked at in a lot of our instances, when we looked at our caregivers were very excited to kind of join in the journey, join in their loved one's journey and be able to be a part of that Zoom call or be a part of that video conversation that was happening with the physician, which I think leads to a better care plan being, implemented because there's two people who are not understanding the care plan. And last but not the least, we always, there are myths that people who are older will not adopt technology. People who are older will just adopt technology for just simple things like, talking to their grandchild and things like that. But that went out the door, just like Dr. Benders shared, like we saw it increase in people adopting video visits and people wanting to engage on our member engagement platforms, which people had not used in the past. So once those myths got dispelled, I think it was good not only for organizations like ours, it's good for providers who also felt the same and wanted from the goodness of their heart to provide those visits in a brick and mortar setting. So I think in the right way, we were able to meet the supply and demand. I mean, what a novel concept that, you are not waiting in the waiting room. Sometimes a doctor is waiting for you. My husband's a physician. And so half the time I'm noticing him telling them, okay, your video should be facing this way. Now turn this thing on, I see you. So I think that calls for a different kind of relationship, a rapport to be formed. And more of those got formed, not only with physicians. I mean, we have so many amazing resources. Our health coaches were not doing any video visits. Now they can engage with them in that particular way. And they're super excited to see our case managers. And people are absolutely correct. It's something to be said when your case manager speaks your language and looks like you're more likely to adhere to the work plan. And in the good old days, we would send them a magnet with a picture of a case manager so they could know it. But now when they can see them face to face, the nurses that can engage with them in chronic condition management programs. So all those resources that were already there suddenly had this, lifting of this regulatory barrier to engage with the populations. So our engagement went up, and one of the proof points for that is, we do a lot of programs around medication adherence to boost medication adherence. And we have folks we call med advisors. These are folks from the community who speak the language, who are trained in motivational interviewing. and they engage with our populations. So they were able to engage with their populations even more. People were more willing to get, sign me up for 90 days online kind of interventions. Our med adherence this year is way higher than what it was last year. So there are some silver linings that are emerging. My only fear is, when we say, telehealth is the future, I just hope after the pandemic, it doesn't go back to telehealth just being a little tool and everything stays the same. I'm still the doctor, I still practice the same way. Yes, now you have a video visit. I think we have to rethink the whole visit, the whole journey, what needs to happen at home, how much of it should be happening at home, what other tools should we be using. And so just closing remark is we participate in a group with IHI called Office Visit as a Dinosaur. And we've been participating in it for the last 2 years. So it's hallelujah for all of us, because suddenly there's a recognition, even in the provider side, where do we need all these brick and mortar stores, or should we be thinking about things a little bit more differently and truly make it, customer centric?
Fantastic. We've had a few questions come in from the audience, and so just want to pause for a minute and address just a couple of them that have risen. And so which of you, either of you, any of you that feel moved by an answer, please feel to chime in. I won't address to a specific one, but question came in from one of the participants of how can virtual care programs better provide interoperability across the spectrum? How do things like remote monitoring actually provide better support to patients of providers that will translate into measurable results? Anybody want to go after the interoperability question and or the remote monitoring translating to patient impact?
I can take a stab at it really quick.
Okay.
We have a few providers that have adopted them a few years back and actually are seeing measurable results right now. Very targeted programs for a very targeted population, mostly around heart failure, diabetes management, which were integrated with the platform they were using for remote monitoring, as well as their Epic medical record system platform. So they could have a kind of a 360 view. So when a patient's A1C or a sugar became available, you had a trigger, there was a nurse on the other end who had a protocol that they could follow, who then had a physician who had backed up. So it was a system that coordinated across the whole thing. I think the worry comes along is when you have remote monitoring happening in a silo on the payer side and the primary care physician is not aware of it, or is happening on the specialist side, and the PCP is not aware of it. But in these things, they are using it as an additional tool for a case management program, a disease management program that is backed to address the concerns as they come up and close the loop and make sure the care plan continues to get updated.
Okay. Dr. Benders-Hadi, I see you.
Yeah, I think you can also develop those disease management programs in a way that makes sense, right? With the medicine, with the science behind it, which is a huge component there. For me, I think it's all about the data, right? I think, you ask any physician and who's worked in multiple healthcare systems, one of the most frustrating parts is, the lack of communication, right? Having one piece of data from here, another piece of data from there, them not talking to each other. So to have that 360 view in a coordinated system where you're able to get all of this information is just going to allow all of our healthcare providers, to do their jobs better.
Dr. Bishop, one came in, I'd love to hear your perspective on how do you see the risk, lack of trust of the doctor making the right decision in relation to virtual care being addressed? I mean, for example, a doctor assessing a mole for melanoma through a picture or video. How do you ensure that the right decision is being made and that the right clinical plan is being implemented and that a decision is as good as a live visit?
Yeah, that's a great question, Jodi. And, I think this has been, as we have all alluded to, this idea of how much this has, the culture of virtual care has transformed. I think there was historically has been this issue of, do I trust the person on the phone? They may not, or on the video, they may not be my primary care doctor. They may be through a company or a service where I don't know who that person is on the other side of the line. And what's been interesting is to actually, again, start to see how when you have a visit that actually works out well and you feel confident with the diagnosis, you feel listened to, you feel confident with the treatment plan, that trust starts to build up. Now, there's certainly things that cannot be at the moment managed necessarily all virtually, where you do need to have physical examination, where it is important to kind of have that face-to-face encounter with someone. And I think many doctors, most doctors are very cognizant of the sort of the limitations of virtual care and what you can and can't do from a diagnosis or management perspective. But we're also realizing that there is a lot we can do. I think about skin and looking at pictures and seeing a video and being able to actually visualize something. There's a lot we can do. And I think there's a lot more technology that's coming down the pipeline and that already may exist in the pipeline, where Dr. Batra, mentioned that things like giving people blood pressure cuffs and giving people pulse oximeters to monitor things. We're seeing more of that coming into the home that will help us do more of that diagnostic capability. But I think the two factors that really stand out in my mind is that idea of how do you instill trust in the person who's on the other side of that line? And then secondly, how do we get the right tools and the right capabilities when we want to start to push the envelope on those diagnostic and treatment capabilities?
Thank you, Dr. Bishop. Dr. Batra, one more coming in from the participants that I'd like to address to you, given some of your prior comments. There's a question here around the increase in the daily data. It's one thing to replace that visit, but the remote monitoring and virtual care moving beyond just a telehealth visit to that remote monitoring that Dr. Bishop's mentioned and Dr. Benders-Hadi's mentioned before too. So how are your companies managing the increase of daily data from their patients? Love the idea of monitoring between visits to help manage chronic care or monitor a condition, but how does a physician or office manage that increase in multiple data feeds and multiple data sources?
That is always the sticky wicket being a primary care physician. Do I really need to know the blood sugar reading 4 times a day for the next 30 days altogether, right? Well, what am I going to do with it? What am I going to do with the 3 times a day that your blood pressure you're checking? And so that's where, when you create programs like disease management programs or case management programs or protocol-driven programs come into play, where they can kind of differentiate between real data and noise and be able to kind of respond to real data in a real-time manner and bring the primary care physician in the loop with the care coordination that perhaps you put in place. So the physician really needs to respond to the things that they really need to respond to. The great thing is we also nowadays have a lot of pharmacist-led programs, which help as well, because the pharmacists are trained starting up at the VA, which has done a lot of studies to show a lot of those things that do not even need to escalate at a physician level can be driven by the pharmacist as long as there's a protocol to do that. So that's where we are still a work in progress, and having the platforms that talk to each other. I think that's the biggest thing, is to have a platform. One thing is to collect the information, but then have a platform that talks to the primary care physician becomes the second thing. So we are working with few of our physician partners in starting to do that. Not doing it willy-nilly, but in very targeted populations. So once again, for us, the highest of the high-risk populations, the folks post-discharge that have certain conditions, those are the ones that we are trying to manage in the first 30 days. So those are the things that we are trying to work off. But I truly believe as well is that tools are going to get sophisticated. We will have more of those tools, and we'll have more algorithms, AI-driven, that keep iterating itself so they can truly kind of differentiate between what's real and what's the noise.
Thank you, Dr. Batra. Dr. Bishop, as we've been addressing this and kind of the implications to the care delivery, to the patient, the advantages and the opportunities, a couple of different times here, we've woven in the thread of reimbursement, regulatory, which also has implications for plans. And given what you are doing inside of Bind Benefits and what you know, given your reach across the industry within the health plan communities, I'm curious, from your perspective, how must health plan design actually evolve to better support the demand for the use of and the burgeoning virtual care market?
Great question, Jodi, and thanks for asking it. I think you're touching on something that I've noticed, having worked in the healthcare system on both the payer and provider side, which is really the value of a healthcare payer to drive value. There's having kind of worked and lived in this area for years and years. The I've seen a lot of changes happening in healthcare that gets driven very much by the way we reimburse and pay for healthcare, and those can be important drivers for adoption and for change. So I think from a healthcare payer perspective, the three things that really stand out as opportunities are: how do we cover this kind of care, and is this kind of care covered? Are there exceptions to coverage? Are there incentives for coverage? And what is the coverage model for this kind of care? I would say the second is the access. So who are the providers that can provide this kind of care? And what is the network, and who are the people that are on the other side of the line? And then I would say the third is the support system. So how can a payer support people to help understand what their options are, help offer various types of solutions that may fit in with their care journeys at the right time for them, and make sure that the resources are available to people. Speaking of those first two, I think we have seen a lot of advances in this area. Dr. Batra mentioned that there have been reimbursement changes and in coverage changes, particularly in the Medicare space. And I think that's, that really you start to see how coverage can really impact access and in use of care. So the fact that now Medicare is actually reimbursing for telehealth, we're seeing more use of that kind of care, and I think that's the kind of role that a payer can play and can think about. How do we reimburse? How do we incentivize? What would be out-of-pocket costs for patients and members? And then what is the access to those different kinds of networks? Whether it is the more traditional networks that are now providing telehealth through their offices, where are there other kinds of programs that we've alluded to, these more monitoring kinds of programs and more virtual care kinds of networks. So I see those as all being holistic ways that a payer can start to incentivize the use of virtual care when, again, when we feel that that's going to be a high value add for members and patients.
Great. Thank you, Dr. Bishop. We appreciate the plan perspective, and equally important is the implication to the provider side. So Dr. Batra, Dr. Benders-Hadi, I'm very curious, and why don't we start with you, Dr. Benders-Hadi. How are you seeing the role of providers evolve? What must providers do, and how must they evolve to engage in a more digital friendly and virtual driven care continuum?
Yeah, so I love this question. And admittedly, I think I can say this without getting into too much trouble, but admittedly, as a physician myself, physicians can really get stuck in operating models and, treating patients in a very particular way, right? But in order to continue to push forward these goals of high quality care and increased access to care through virtual means, it can't just be on the health plans or the employers or the patients, right? I think that we as providers have a responsibility there too. So that involves, not only learning the technology, but things like what we call not bedside manner, but webside manner, right? How you're engaging virtually with patients, what your lighting and background look like, how you're eliminating distractions during that visit to build the trusting relationships between doctor and patient that we're really talking about here. I think another point that really can't be emphasized, it can't be overemphasized, is that with virtual care, we have access to so much more information on things related to the social determinants of health than what is typical with your brick and mortar settings, right? So if we really truly want to impact overall health of the people we're serving, you have to take into consideration all of the factors outside of the traditional doctor-patient visits and traditional healthcare settings, things like environmental factors, housing stability, food security, all of which are going to impact the health of that individual that you're seeing. And with virtual care, the beauty is that we have perspective into a lot of those factors in a way you never have before, right? If you're able to take your physician to your fridge when talking about nutrition and take a look at what you're actually eating to explore why you're not able to lose weight, for example. I mean, those are things that you typically can't do. And when you're talking about preventative care and improving access, improving outcomes, reducing costs, all of those things are critically important.
Thank you. Dr. Batra, I know you have a perspective here as well. How do the providers need to evolve from your perspective?
Yeah, so two points. I wanted to first build on what Dr. Bishop just shared about what could payers also do to help support virtual health. Once again, we are in the MA space where we have the flexibility to provide supplemental benefits, which don't have to be truly medically related benefits. And so for the past couple of years, we've been providing access to urgent care on demand, just like Doctors on Demand, we have MD Live. And it's interesting, for the first year, we had a copay attached to it and the adoption was really, really low. And this year, the past year, actually, we took away the copay, so that's a barrier. The adoption went up, and obviously during the pandemic, it went up a lot. So how you design your benefits so that you're ensuring that kind of an access by taking away the barriers is one thing. The second thing, which I'm very excited about, which we did this year after our experience with the pandemic, we now offer a benefit that we call health tech. So you can call us anytime. Any of our members can call us to help them with anything related to setting up a device, a video visit, any kind of a technology assistance. So it's a little help desk for our own members and their caregivers so they can access care. Because we realized during the pandemic, half the time my poor nurses and case managers were helping people set up, okay, you download this, now you go here. So we decided we're going to offer it as a benefit to our entire population so that they go ahead and access it. So I think benefits play a huge role. Thirdly, from the benefits perspective, we have member engagement platforms where you can learn to manage your diabetes better, you can learn to manage your hypertension better, you can set up peer communities. But in the past, there was no way you could incent people on doing it. But with Medicare flexibility, now we can even offer people gift cards. Hey, if you want to understand about the 6 modules in diabetes that talk about how to manage your diabetes better, A, it incents them in learning more about how I can do that. And B, it takes away that barrier, that initial, the lack of momentum. Once you get in, you start playing with it. There's so many other different modules around anxiety and stress and resilience and sleep and things like that. So that's the third thing we are looking into doing. So that's from the payer perspective. From the provider perspective, I think all the providers learned during this pandemic that it is more efficient from their perspective as well in setting up these visits, being able to do these visits, and still keep in touch with their patients in a good manner. But for us in California, we also live in the world of value-based care. So most of our contracts are capitation-based contracts with the providers. So during the whole pandemic, the providers who are capitation risk-based contracts, they were thinking outside the box and making sure that they were doing everything to set up digital front door, back door, side door, whatever you may call it, so they can engage with their patients. So that's how we came through those drive-throughs where you could get the iPad, have the visit, or the iPad gets dropped off to you, or the medical assistant goes with. So all those kind of innovations started there. Now, the key is going to be if after the pandemic, those reimbursements continue to happen, because MA is a small proportion of any provider's panel. But if Medicare fee-for-service continues to reimburse at the same rate, right, what it is doing right now, and doesn't add any new regulatory barriers, which means you can still use FaceTime or whatever you're using, I think the momentum will keep growing and more people are going to adopt it. This is my pure speculation and very bad synonym, but like the tube is outside the tube, the toothpaste is also already outside the tube. I don't think they can take those things away and start putting barriers on the place, because people have gotten used to it.
So we have 5 minutes left. We've had a number of questions come in. A number of them could be bundled around looking at the future. So Dr. Batra, I'm going to actually start with you. As we look beyond 2021, we've had discussions around patient preference. We've talked about regulatory. We've talked about technology and the potential of where AI could help. We talked about payment models and provider preferences. So as you look at it, what, and I'm going to ask each of you to close us out on this. So Dr. Batra, you first. Looking out beyond 2021, what does the future hold for virtual care in a post-COVID world?
I think I believe a lot in proof points, and they were very interesting proof points that emerged last year. We had huge uptick in adoption of telehealth visits in March, April, May. Then they started slowing down and actually going down, and then we had a little bit more rise, where it's, I would say, around like 40% more, 50% more. So I think looking at the future, I personally believe that the regulatory barriers will be taken off, just like what's happening right now. I absolutely believe that there will be some kind of reimbursement. I don't think it's be just exactly the same, which is site neutral kind of a payment. So people will still be incented in doing it. I also feel that people have adopted it completely in many, many different ways. It's a part of their life. They would be hesitant to go back full-time to the office. They'll still go back because they still want that touch sometimes, and certain things have to be done in the office setting. So I think we'll reach a steady state of where X percentage of visits, which I'm thinking will be more towards the virtual visit side, and 20, 30, 40% of them will be in the office setting. And I think we, speaking from a payer perspective, will be thinking outside the box in how do we enhance it? How do we scale and provide more value so people come and adopt these in more different ways? I wouldn't be surprised if we have programs that offer iPad with modules loaded up that you can manage certain things better for certain populations. And because they will show there is a ROI towards the end of it as well, so it will pay for itself. So I think all those things will come into play. It'll be very hard for providers to go back to the pre-COVID normal. There'll be a new normal. And, we will have to learn, just like Nikole said, we'll have to learn the website manners. And so that's actually what we're working on right now, is how do you go from website to website manners.
Yeah, that's one of my learnings from this hour that I'm going to take away, Dr. Benders-Hadi, is the website manner. It'll be my new area to learn more about. So coming to you, Dr. Benders-Hadi, what would you prophesy? What do you see as the future post 2021, post COVID?
Yeah, so from the provider and practice management perspective, I think the sky's the limit, which is really what's so exciting about this space. And similar to what Dr. Batra was just saying, I'll just piggyback on some of that. I think it's the different models of care delivery that I think are going to be coming to us fast and furious, right? So opportunities to develop more integrated care experiences, right? Developing primary care where your go-to medical provider is virtual, but integrated with that is your behavioral health care, your specialty care, all in the same place, for continuity, for improved medical record sharing and communication. Because again, the return on investment there is going to be very, very clear when you have engaged patients who are sticking with practice and getting the kind of preventative care that they need as well. I think there's also just the opportunity to expand on the kinds of subclinical offerings so that people just are not getting as sick, right? Having multiple points of care to meet patients between visits, whether that's with your health coaches or your care managers, using more self-guided activities and content. That's going to help us meet patients where they are, providing just the individualized care for them across their lifespan.
Thank you. Dr. Bishop, last comments from you about the future?
Yeah, thanks. I'm going to just layer on to what I heard from both Dr. Batra and Dr. Benders-Hadi. I think you're right. We are in a new normal. I don't think we are going to go back to a phase where 95, 99% of care was all in the office. I think we're going to have a new normal where it will be a certain percentage is going to of care just in general is going to be delivered virtually. Secondly, I think this is a real opportunity and a new forefront for patient engagement. So Dr. Benders-Hadi mentioned the ability for people to understand their conditions, to find information on their conditions, to engage in different ways. This is a real, I think, future opportunity. And as a practicing physician, it's been one of the hugest challenges is keeping people engaged to really care about their health and to continue to manage their conditions. So I think there's a real opportunity in patient engagement. And then I am so excited about innovation. I think we are just touching on the cusp of where technology, where data, where innovation is starting to happen, and this cultural shift, this seismic shift in how we're delivering care is just going to, I think, open up a lot of innovation in the area.
Wonderful. Dr. Batra, Dr. Benders-Hadi, Dr. Bishop, thank you so very much for investing your time and spending this hour with us and sharing your insights to Bind Benefits, and to Medical Alley. Thank you for hosting this conversation, and to all our participants. We hope you learned something today. I know I did, and we wish you a very good day. Thank you, everyone.
Thanks.
Thank you.